Hi, hello everyone. I am your nursing student Brian, and for today's video, we are going to perform the physical assessment of the heart. Without any further ado, let's start the procedure. Prior to performing the procedure, we need first to introduce ourselves and verify our client's identity. Hi sir, good morning. I am your nursing student Brian. So you are Mark Petronio, I am correct?
Yes.
So you are born on July 8, 2008.
Yes.
Okay, so you're from Burawen, am I correct? Alright. So after that, we need to perform hand hygiene. This is to prevent ourselves from the transmission of any viruses or bacteria. After that, we need to provide clients privacy by providing him first procedure in assessing the physical examination of the heart is we need to inspect for any pulsations on anterior chest over the heart of our patient. Okay? We need to ask our client in a supine position with the head of the bed elevated to between 30 and 45 degrees. And we need to stand on the client's right side and look for the apical impulse and any abnormal pulsation. Okay? Sir, I'm going to inspect your apical impulse and any abnormal pulsation. Okay?
Okay.
Alright. So, can I touch you, sir? Is it okay?
Okay.
Okay. Alright. So based on my inspection, there is no abnormal pulsation and the apical impulse is not visible. If it is apparent, it would be on the mitral area, left mid-clavicular line, fourth or fifth intercostal space. So the apical impulse is a result of the left ventricle moving outward during the systole. Alright, so next procedure is we need to palpate the apical impulse. Okay? Remain on the client's right side and we need to ask our client to remain supine, in a supine position, and we need to use our finger pads, two finger pads to palpate the apical impulse and the mitral area. Okay? Sir, I'm going to touch you. Is it okay?
Okay.
Alright. Okay. Alright. So, based on my palpation, the apical impulse is palpated in the middle area. The duration is brief, lasting through first two-thirds of a systole and often. Next procedure is we need to palpate for abnormal pulsation. We are going to use our palmar surfaces to palpate the apex, left sternal, border, and the base. Okay, sir, I'm going to touch you. Would it be okay?
Okay.
Alright. Okay. Okay. Right. Okay. So based on my palpation, there is no pulsation or vibration are palpated in the areas of the apex, left sternal border, or base of the heart. Next is we will move to the auscultation of the heart rate and rhythm. Okay? We are going to place the diaphragm of the stethoscope at the apex and listen closely to the rate and rhythm of the apical impulse. Okay, sir. Alright. So based on my auscultation, the heart rate is normal. It's 70 beats per minute. This is regular. My client is not experiencing from bradycardia and tachycardia. Therefore, no indication of heart failure or embolism. Next procedure is we need to auscultate, identify S1 and S2. Okay? We are going first to auscultate the first heart sound, which is the S1 or the lab sound, and the second heart sound, which is the S2 or the dab sound. We need always to remember that these sounds make up the cardiac cycle of systole and the diastole. Okay, sir, I'm going to touch you and auscultate for to identify S1 and S2. Is it okay?
Okay.
All right. I'm going to touch your carotid artery. To palpate your artery, carotid artery. Okay. The base. Okay. So based on my auscultation, the S1 correspond with each carotid pulsation and is loudest at the apex of the heart, while the S2 immediately follows after S1 and is loudest at the base of the heart. Next procedure is we need to auscultate for extra heart sound. Okay, we are going to use the diaphragm of our stethoscope first, then the bell to auscultate over the interheart area. Note the characteristic of extra sound heard, okay? Alright, I'm going to use my stethoscope. So we are going to auscultate in the aortic, pulmonic, Erb's point, tricuspid, and mitral area, okay? Using first the diaphragm. Okay. And the mitral area. And we are going to repeat this sequence or the process using the bell of the stethoscope. Alright, so based on my auscultation, there is no sounds are heard as injection sounds or clicks, friction rub, ventricular gallop, S3, and arterial gallop, which is the S4, and there is no indication of heart procedure is we need to auscultate for murmurs, okay? Murmurs is a swishing sound caused by turbulent blood flow through the heart valve or the great vessels, okay? So in this procedure, we are going to auscultate for murmurs across the entire heart area, which is the aortic, pulmonic, Erb's point, the tricuspid, and the mitral area, okay? We are going to use the diaphragm and the bell of the stethoscope in all areas of the auscultation because murmurs have a variety of pitches, okay? Sir, I'm going to auscultate your heart. Is it okay? In all areas of your heart, is it okay?
Okay.
All right. Okay. Pulmonic. Okay, let's see the Erb's point. the tricuspid, and the mitral area. Alright, let's repeat it again using the bill of the stethoscope. And the mitral area. Okay. So based on my auscultation, no murmurs are heard. There is a presence of innocent and physiologic mid-systolic murmurs, which is very normal in a healthy heart of our patient. No abnormal sounds such as the pathologic mid-systolic, pan-systolic, and diastolic murmurs. Everything's fine in our patient's heart. Everything is good and well functioning.